Hello.
We will just wait for 10 more seconds to let people enter the room.
Do you hear me well?
Yes, we hear you well. Thank you, Doctor.
I hear you guys well as well.
Thank you. Okay. Thank you all and welcome to this MS Patient Day webinar. The time is 7 p.m. here in the UAE. We'd like to thank you and from wherever in the world you are joining. My name is Gerard Moore from Focus Gulf Conferences and I am the Technical Support Manager for today. If you have any issues or any problems, you can send me a private message. Click the admin question at the bottom right of your screen and then I will receive it and I will help you. If you have any video issues or audio issues, at the top of your screen, you will see a reconnect button. Please reconnect and then your audio and video will be resynced and it will work fine. You can send private questions to me in English, or you can write the chat bar in English and also in Arabic for Dr. Ahmed Shatila. Dr. Ahmed will be the speaker today. The topic is Intro to MS, and it is also have a patient success story. We will run for approximately 1 hour, where you can, the doctor will give a presentation at the beginning, and then we will have a Q&A panel session at the end. Please note that Dr. Ahmed will not be unable to answer any confidential or detail about your personal issues that you have. Please keep any questions related to the topic itself. In the interest of fairness, we must ask you to not send any questions or any details about your own situation, please. Right now, I will hand over to Dr. Ahmed to start the webinar today. Dr. Ahmed, the floor is yours.
Thank you, Gerard. Good afternoon, everyone. First of all, I'd like to thank everyone for attending this event. I'd like to thank the sponsors, and hopefully today I will be giving a lecture or a presentation about MS. As an introductory for some people, this may be basic information. For new people who are diagnosed recently, this is new information, and hopefully the people who already know something, this will add to their knowledge base, and the people that are recently being diagnosed or having a new family member with a new diagnosis, this will help them learn a little bit more about the disease. As Gerard had mentioned, I'm Ahmed Shatila. I'm a neurology consultant at Sheikh Shakhbout Medical City. So what is MS? In 1868, John Charcot first scientifically described a set of conditions or symptoms that would later become known as MS. MS is a chronic inflammatory and degenerative disease that is part of the family of inflammatory diseases with an autoimmune component. So what is autoimmune? I'm going to be talking English Arabic, hopefully, because that way everybody can get something. So autoimmune basically بالعربي it means أمراض مناعة ذاتية, which means الجهاز المناعة بأنه عادة بتهجم على الجراثيم الفيروسز ليحموك. لسبب ما بنعرف ليه الجهاز المناعي بيهجم على الأعضاء جسمك، إنه الأعصاب، المفاصل وغير organs. So الأمثال similar أمراض مناعة ذاتية هو الروماتيزم، المرض المفاصل، الصدف psoriasis هيدا بيأثر الجلد، السكر الأطفال type 1 diabetes كمان مرض مناعة ذاتية، lupus الذئب الحمراء مرض ذئب الحمراء. Again هيدول كلهم أمراض مناعة ذاتية، يعني الجسم عم تهجم حالها لسبب ما بنعرف ليه. Next. So what is MS? مثل ما حكيت إنه MS is an autoimmune disease، هو مرض مناعة ذاتية. عادة MS it affects women أكثر من men 2 to 1، يعني لكل 2 نساء في واحد رجال who has the disease. أو بشكل عام بين كل 100,000 شخص في 100 واحد عنده المرض، عنده MS أو عنده الحالة. 1 out of every 1,000. وبشكل عام الحالة the condition بيأثر younger people. شو الأسباب للMS؟ هلا MS بعد لحديت هلا we don't know why people get MS. But one of the theories is genes إنه وراثة يمكن يكون شيء بالطبيعة بالجو اللي عم إنه نحن عم we're getting coming across it which is causing us to get MS. يمكن يكون خاصه بشو فيروس أو جرثومة إنه حدا عم يكمشه وهي عم بتسبب MS. So we don't know but we think إنه هو الMS أسبابه من وراء هالثلاث أشياء. مين شو العمر إنه on average what's the average age for MS؟ إنه بهالجراف اللي هلا I'm showing as you can see ما في كتير MS فوق ال 50 سنة وما في كتير ناس عندهم MS تحت ال 20 سنة. معظم الناس اللي عندهم MS بين ال 20 وال 50 سنة. والمعدل the average is 27. How does MS progress? It's variable and unpredictable. What does that mean? It means إنه بس لأن even if you have two people with MS, each person can have a different disease, different symptoms. في عندي I have patients بيتابعوا معي. في ناس عندهم MS for 20 years and they have no symptoms. ما عندهم أي عوارض. وفي عندي مرضى عندهم MS بس 3-4 years وalready عم ببلش عندهم صعوبة بالمشي. So كل واحد غير. كل واحد مرضه غير. So ما فيك you can't compare تقول my friend عنده MS ليش هو هيك and I'm different. Every person is different. في بعض الناس بيجي لهم هجمتين 3 بالسنة. في other patients بيجي لهم one attack كل 10 سنين. Again ما إنه it's not connected. لأن المرض presents أو بتفرج حاله لكل واحد غير في بعض إنه هي it's very hard إنه كثير صعب لواحد يتشخص ب MS. في دراسات بتفرج إنه عادة بدك 5 سنين من واحد ما يبلش يتعرض أو يبلش يشكي من عوارض ليطلع diagnosis of MS. لما بيروح عند كثير دكاترة he goes to multiple doctors, maybe a psychiatrist, maybe the eye doctor, maybe a skin doctor, all complaining about different things, and it's only until he goes to a neurologist أو بيروح عند حكيم أعصاب and that he gets diagnosed with MS. شو العوارض؟ As I said, it's very variable. إنه المرض is very variable. إنه no two people have the same disease. بس عادة the symptoms that most people complain about are visual disturbances, مشاكل بالعصب البصري, weakness, قلة توازن, يمكن يكون في إرهاق, fatigue, معقول يكون في تشنجات بالعضل, spasticity, قلة توازن, unable to walk, ataxia. يمكن تحس إنه في تنمل بإيديك أو إجريك, أو مشاكل بالبول أو البراز. These are all things إنه كل واحد معقول يكون عنده كل هالعوارض ويمكن يكون عنده واحد من هالعوارض. إنه وكمان just because عندك you have one symptom doesn't mean that your disease is going to be worse than someone else. So this is a typical MRI. This is an MRI of a brain of someone who has MS. As you can see, هيدال النقاط, or as we say التصلبات, these are the MS plaques, which can cause the symptoms that people have. On average, we say that you can have 10 of these for every one symptom. Oh, sorry. Okay, well, this was supposed to be a slide that had animation, but I guess it doesn't work like that on PowerPoint. Well, so basically, you have 3 slides here, or 3 pictures. The first picture, it shows a neuron. As you can see, this is the cell body. This is the main center of the neuron, and this is here in your brain. Every neuron has this long cable. This is called the axon. And كل neuron عنده axon. This is the telephone or the electrical circuit that sends the message to your muscles, to your limbs. And some nerves, it can be as long as your spinal cord. هالعصب فيه تكون طول النخاع الشوكي. So, and normally what happens on a normal nerve, a normal neuron, the signal jumps like this, as you can see, from node to node. This makes the signal go faster. قد fast 60 متر بالثانية. عادة بلا MS without symptoms هالعصب هل سجنه بيمشي 60 مرة بال 60 متر كل ثانية. هلا ان ام اس بيصير في تليف او تصلبات بالمايلين. This is the myelin. And instead of going 60 meters a second, it slows down. And now it's a lot slower, and that's what causes people to have symptoms. Now, if that plaque happened in your optic nerve, you would have vision problems. If it happens in your spinal cord, with the nerves that controls your hand and feet, you may have problems walking or with clumsiness. So again, it all depends where that lesion occurs, and then you'll have symptoms based on that lesion. So what's the burden of MS? We do know now that for people with MS before treatment, on average, as you can see, without medicine, without treatment, this disease can be progressive. And what does that mean? It means that you lose brain cells. On average, you lose more than 0.4%, you can lose more than 0.4% of brain cells due to the disease. And untreated, that causes symptoms. You may get cognitive problems with walking, understanding, with time. On average, it takes about 15 years for someone with MS who's not on treatment to use a cane, and 25 years if you're not on treatment to be in a wheelchair. So these data were based on a time when we did not have treatments. We now have treatments, but I'm not going to talk specifically about treatments today. But I think I'm going to mention that it's important to see a neurologist and follow up with your physician if you do have MS, because untreated, it can cause serious disability. With treatment, you can potentially change the course of your disease. What are the types of MS that we have? Now, as I can say, the first type of MS is relapsing remitting. What does that mean? This is 85% or 85% من الناس اللي عندهم MS عندهم relapsing remitting. إنه what happens؟ واحد بيكون طبيعي ما عنده أي عوارض، بيجي له انتكاس، either مشاكل بعصب البصر، قلة توازن، تنميل، and he gets worse. Then with time مع الوقت بيرجع بيتحسن. لا يجي الانتكاس or the relapse to the second one, so he gets worse. وهالشخص you live like this. Relapse is remission. You get good, you get bad, you get good, you get bad. And here's the thing, 85% of all people with MS are like that. And all the treatments, actually, most of the treatments we have are for relapsing remitting patients. Now, as I said, once you go into 15 or 20 years of disease, you can go into what we call secondary progressive. That means now you're not relapsing. ما في هجمات, ما في انتكاسات, but there's a slow, gradual deterioration. That is our secondary progression. Why is that important? ليش secondary progressive مهم كتير؟ ما في أدوية لو secondary progressive. عندنا بس دوايين for secondary progressive MS. عندنا أكثر من 13 دواء for relapsing remitting MS. We only have about two, maybe three medicines we could try for secondary progressive phase. For the relapsing remitting, we have more than 13. That's why it's important to treat early and treat aggressively so that we can prevent or delay disability, so that when you go into the secondary, we can either delay it or potentially stop it. Now, a small proportion of people, less than 5%, have what we call a progressive phase. This is they get worse from the beginning, بيتدهوروا من البداية وما في انتكاسات وما في هجمات. كيف بنشخص MS? How do we diagnose it? أهم شيء, the most important thing is the history. المقابلة مع الطبيب, مع الدكتور. Your interview with your doctor will help decide if you have MS or not, because he will ask you, he will get a history from you. He will ask you when's your symptoms started, what kind of symptoms, are they getting better, are you getting worse. كل هيدا الأسئلة الطبيب اللي حيسألكم, that'll help diagnose MS. You can't diagnose MS from just the MRI, لأن الرنين you can't use the MRI just as a diagnosis without the history. كله مع بعض بيساعد. لازم يكون في رنين للقاع الشوكي والمخ. You need an MRI of your brain and spinal cord. Some people may need a visual evoked study. أو فحص كهربي العصب البصري. And very few people, and some people may even need a lumbar puncture. أو إبرة ظهر in order to test for certain parameters that are higher in people with MS. I gave a general description of MS. I gave a general, عملت انه وصف about MS بشكل عام. هلا بدي احكي عن some symptoms. I'm going to talk about some symptoms of MS. These are the symptoms that are common, but not a lot of people talk about, or not you may be embarrassed to talk about, or you may forget. And these are important things. العوارض هلا حاحكي عنهم هن كتير مهمين، وفي كتير ناس بيجوا للعيادة اللي عندي يمكن عندهم العوارض بس مستحيين. They don't know, they don't think maybe I should know about it, or maybe they're not thinking about it. So I'm going to talk a little bit, and if you have these problems, or if you know someone بيعاني من هالمشاكل أو من هالعوارض, please see your doctor. So first thing is depression. الاكتئاب. أكثر من 66% من الناس اللي عندهم MS show some signs of depression. وشو العوارض؟ sadness, hopelessness, بيفقد الأمل، اكتئاب، ما في interest in things، بيروح الشهية either decreased or increased. You have no, you can't sleep, either عم بتنام كتير أو عم بتنام شوي. All of these are عوارض اكتئاب, which أكثر من ثلثين الناس اللي عندهم MS معقول يشكوا منه. But yet, إذا ما بتخبروا طبيبكم أو الدكتور يمكن ما يعرف. Fatigue, إرهاق, very common. أكثر من حوالي 80% من الناس اللي عندهم MS بيشكوا من fatigue. شو يعني fatigue؟ هلا everybody بيطلع له fatigue إرهاق. But this is fatigue after little activity. This could be fatigue. ما هيدا معقول يكون fatigue بس لأن طلعت one flight of stairs. طلعت على الدرج. This could be fatigue because you went to the bathroom or you went to the kitchen to get a cup of water. So it's not like normal people without MS fatigue. And it can interfere. بيأثر بالحياة اليومية للشخص اللي عنده MS. As I said, it can get worse as the days goes by. Now, في بعض الناس can't say that fatigue خاصهم بهجمة or relapse. It can happen. شيء تاني, difficulty walking. أكثر من more than 50% of patients with MS will have difficulty walking at 10 years. يعني شو يعني؟ 50% من الناس اللي عندهم MS حيشكوا من صعوبة مشي بأول سنة من التشخيص، وأكثر من 80% من الناس اللي عندهم MS حيشكوا من صعوبة مشي بعد 10 سنين. So I'll say it in English again. 50% of people with MS will have difficulty in the first year. More than 80% will complain of difficulty walking by year 10. Significant. It definitely affects your life. And there are things that we can do that can help. Someone who's complaining of walking, he or she may be eligible or may benefit from a cane or a crutch or maybe a wheelchair. There are some medicines that we can do, and we can also look for other reasons why someone is being fatigued. Not everything is always because of MS. As I tell my patients, you can have diabetes and have high blood pressure. They're two different conditions. So just because someone has MS, not everything is from MS. مش كل شيء من MS. You still have to look for other causes. Sexual dysfunction. More than 50% of people with MS, أكثر من نص الناس اللي عندهم MS will have حيكون عندهم مشاكل بالأعضاء sexual dysfunction. 20% will become less active. هلا why؟ في عدة أسباب. معقول يكون في تشنجات بالعضل, spasticity, making it hard, to open or close someone's legs. Fatigue, إرهاق. معقول يكون self-esteem is low. And قيمة نفسه, he may be depressed. All of these can affect with the sexual desire and sexual urge. Bladder problems. مشاكل بالبول والبراز. This can happen. People can complain of hesitancy. You have an increased desire. What does that mean? شو يعني increased desire? Meaning that لما you need to go to the bathroom, في صعوبة, you cannot stop. Usually الناس اللي عندهم MS وعندهم مشاكل with bladder, as soon as you go to a place, you're already عم بتفتشوا على الحمامات. Where are the bathrooms? Just in case you need to go to a bathroom. It's very common. It can definitely affect someone's quality of life, and there are treatments for it. في أدوية that we can do اللي يساعد إذا حدا عنده هيك عوارض إذا عم بيشكي. Spasticity, muscle stiffness. Again, في بعض الناس may have this stiffness, cramps, تشنجات بالعضل, causing pain. في أدوية, there's stuff that we can do إنه بيساعد. Again, if you don't tell your doctor, إذا ما بتخبروا الدكتور I can't know and I can't treat you. So that's why it's extremely important to be open. Physical therapies. So physical therapy is extremely important. Physical therapy has been shown to help people with MS. It can help with easing the muscle spasm, range of motions. It can help someone learn about falling, tips and tricks to prevent falls. So شو يعني إن بالعربي؟ Physical علاج الوظيفة, physical therapy وعلاج الفيزيائي are very important because أول شيء معقول they can do تمارين رياضة in order to loosen يخفف تشنجات العضل. معقول you may need a scooter, a crutch, إنه عصاية, a cane, or a wheelchair. هن they'll see you and they'll help you. So it's important to be evaluated if you are having problems. Exercise and physical activity. Now, the MS, there is what the doctor can do, and then there's what you can do. No, what does that mean? مع أي مرض الدكتور كان only يعمل حد معين وبعدين المريض هو لازم يعمل اللي يكفي. إنه أنا بس فيني أوصف الدواء. I can give you advice, but you have to exercise. You have to eat healthy. You have to keep walking, keep making your muscles active because, as we say in English, use it or lose it. إذا ما عم تمشي كتير على أكيد حتتعب أكتر من واحد عم يمشي. Even if you both have MS, and it's been shown, walking بيساعد المشي. It helps your balance. This is exercise. بيساعد التفكير, cognition. بيخفف الإرهاق. بيخفف الاكتئاب. وoverall بيحسن النمط الحياة or quality of life if you have MS. So exercise is extremely important, and that's where some people usually عم بيقولوا طيب أعطيني الدواء يلا خلصني. It's not just about medicine. And treatments, we will stop right now. That is it, the presentation. But this will be a next lecture for another date and another time where we will discuss treatments and importance of nutrition as well as more exercise training and what examples we can do. The reason why this is another lecture is because more time, and I'd like to dedicate more time for this because, as I said, there are more than 13 drugs. So it's out of the focus of this group, this lecture for today. Thank you very much. And now we'll open the floor to questions, or if we want, we can start off with our guest. Our guest. I guess we'll start off with our guest. Yassine, how are you?
Thank you, Dr. Ahmed. I think before we go to Yassine, because for those of you that don't know, Yassine is a very successful patient story. Yassine, your audio, maybe you need to unplug your headphones. What we will do, yes, we can't hear you, is maybe Dr. Ahmed, there's been many questions here. So what we'll do is maybe we will ask some questions to you first, and then we will finish with the patient, with Yassine's amazing story to finish.
So let's do that. We'll answer some questions, then I'll introduce Yassine for our audience. Thank you, Jar.
Yeah. Okay. So first of all, thank you very much for a great lecture. I had so many questions, both in English and Arabic, come to me on the private public forum. So what I would like to...
Assalamu alaikum, Doctor.
Alaikum salam, Yassine.
My voice is good?
Your voice is excellent.
It's good?
It's excellent.
Thank
now
you,
I hear
Doctor.
you. Thank you.
Yes. Okay, Yassine, can you just put your microphone on mute for now? And then
Okay, it's okay, no problem.
we'll do some questions and then we will come to you at the end. Thank you, Yassine. Okay. The first question from an English-speaking person is it normal... I've just been diagnosed with MS. Is it normal to have slowness in my understanding or reactions, or am I overthinking it at the moment?
First of all, thank you for attending and thank you for the question. No, it is very common for people with MS to sometimes complain of difficulty with remembering things, or they may say I'm forgetting things, or I'm having a difficult time doing complex tasks. It can happen. It's not always related to MS, though. Other conditions can also cause problems with focus and memory, depression, thyroid problems, lack of sleep. But so in general, the answer to your question is yes, MS can cause some issues with slowness and focusing, but also other conditions, and that's where you would need to get checked out for that. Okay.
For those people that are early on in their diagnosis stage of MS, a couple of questions I received were, will I develop new symptoms as I progress through MS?
MS this is in English or in Arabic?
English, sorry, English.
Okay, MS is a chronic disease. MS is مرض مزمن, chronic, meaning that just because you don't show symptoms, you may still be getting attacked. معقول بس لأن واحد ما عم بيحس بعوارض مش يعني إنه ما في تصلبات, ما في نقاط عم بيتجمعوا بالمخ. Doesn't mean that you're not getting accumulation. Now these accumulation are happening. As I said, you can have 10 lesions, 10 نقاط تصلبات for every one symptom. So yes, to answer your question is, just because you feel good doesn't mean that your disease is stopped. It is important to follow up, get MRIs, get examined every year or every 6 months, depending on how bad your MRI is to begin with.
Thank you. This question in Arabic, and it's to do with family planning, and we did have a family planning webinar that we can send to this person afterwards. But you touched upon the sex life and family planning. This person was concerned about starting a family. What if they're able to start a family, just been recently diagnosed with MS?
The answer to your question بالعربي نعم. MS ما بيأثر على القدرة لحدا يجيب أولاد or get pregnant. It doesn't affect your ability to get someone pregnant. Well, if you're female, you can get pregnant. MS ما بيأثر عليها, and it doesn't affect the baby. ما في أي دراسات بيقول that MS الناس اللي عندهم MS their kids are no ما في أي nothing that they're worse than anybody else. So if it's up to you if you want to have kids or not, but I can tell you that the disease المرض ما بيأثر على قدرتك تجيب أولاد أو قدرتك أولادك live a happy healthy life.
Thank you.
Thank you.
And again, we did do a webinar in case you missed it on family planning. We can just, if you want to email us, me for that, then we will send you that link. You can look at it. It's 1 hour on family planning. The one question in English, I said, and I know we had this webinar coming in, but what is your, as a doctor, what is your definition of a good treatment pathway?
Excellent question. I'll answer this in both, Ingars, because it's an important question. السؤال is asking كطبيب شو يعني العلاج منيح؟ شو يعني المريض عم بيكون منيح? What's a good treatment? What's a good pathway? And I'll say اللي بيشتغل معك is the best medicine. Whatever works for you is the best medicine. Meaning, if you are not having attacks, relapses, إذا ما في أي هجمات، ما في انتكاسات, there's no progression, ما في تدهور, ما في تجمعات أو نقاط جديدة أو تصلبات, you have no lesions, no new spots in your brain, then you're doing great. You are what we say NIDA, no evidence of disease activity. يعني that is the best medicine for you. That's what I would say. So الدواء اللي بيعمل كل هيدا الدواء that's the best, the أفضل شيء.
Thank you, Doctor. Another question, it came in English, but I think it's good for you to answer both again, is when you talked about fatigue, there were quite a lot of people came and said, how can I combat fatigue? It's the most brutal part of MS. What can is there anything else I can do to combat this fatigue?
Yes, there is. Fatigue it is an important issue with people with MS. And it's one of this, unfortunately, it can be underlooked at sometimes. We don't have a lot of good medicines for fatigue, but there are things that can make it worse. في أشياء الإرهاق إنه السؤال إنه is asking للإرهاق شو فينا أعمل شو فينا آخذ لخفف العوارض. It's very common as I've mentioned. هلا في أول شيء بدك تفتش على الأسباب تانية معقول يعمل عوارض إرهاق or fatigue. We got to look for other causes: lack of sleep, قلة نوم, depression, اكتئاب, مشاكل بالغدة الدرقية, thyroid problems may cause fatigue. إذا كل هيدا طبيعي, there are medicines that we can do that may help decrease the fatigue. Exercise is important. Exercise has been shown to help fatigue. Physical therapy is important. يعني الاكسرسايز علاج الطبيعي بيساعد للناس اللي عندهم ارهاق وتعب زياده عن اللزوم. Thank you.
Thank you, Ahmed. Again, a question that's coming in English. This person, again, very recently diagnosed with MS, and they're worried about the job security and if they can get a job and that social aspect, which I suppose we haven't really looked at. So is there any advice you can give to them about carrying on their careers, keeping hold of their jobs? What do they say to their employers? I know this is a very kind of delicate issue, but in your experience, but how do you go about this?
Thank you, Gerard. It's an important question. السؤال هو إنه MS بخصوص الشغل والوظيفة، وإذا بنخبر ولا ما بنخبر، وكيف how do I manage MS with work? The problem with this question is it all depends where you live. You know what I mean? إنه المشكلة مع السؤال إنه MS مع وظيفة إنه كل واحد حسب وين عايش. إنه الحمد لله إنه بالدولة أنا ساكن بالUAE بالدولة الإمارات العربية المتحدة. الحمد لله there's a very active program for people with disabilities that the government does. They make sure that, as I'm saying in English, they make sure that people get handicap stickers for their car. They have assistance. There's a special car called the People of Determination for people with physical disability. So in the UAE, they do a great job helping people with disabilities. Again, your job, what do you do? It may depend on what your job is also. I mean, for example, if you drill for oil in the middle of the desert and you're having weakness, you may need to start evaluating, is this job what I need to do in the next 10 years? So again, it matters where you live and it matters what kind of job you're doing already. So a little hard.
Yeah, of course. Thank you for answering. A number of private questions came to me regarding mental health, and I would ask the people if you can just wait for a couple of weeks. We're going to have a mental health webinar on July the 11th. This is the first webinar of around 8 that we'll be doing every week, each on a different topic. When you registered on the webpage, you would have seen the schedule. So we do have a mental health webinar coming up, so we will answer any questions you have regarding mental health, because I know it's a very important time, especially in the time of COVID and generally. So please bear with us. We won't go into mental health now because we could spend the next hour on mental health alone. Doctor, another question is, and perhaps it's not relevant to the UAE in GCC, but we have many people from all over the world, and they're asking some people. One person asking, is it okay for me to still drink alcohol, like have wine with MS now, or is it not recommended?
The only thing I would recommend for someone asking me, can I drink alcohol? What I would say is you would just make sure with your doctor that the alcohol is not affecting your medicine, because sometimes drugs, alcohol, and medications can interact and affect your medicine. And also make sure you're safe. If you're having clumsiness or unsteadiness on your leg, I wouldn't want you to be drinking, or at least you got to drink responsibly, because I don't want you to hurt yourself more than you already have or have another problem. That's what I would tell someone if they asked me if they wanted to drink. So make sure it doesn't interact with your meds, and make sure that physically you don't hurt yourself if you are going to portray in this activity.
Okay. Well, I think we'll leave the first part of the questions there, because we've had many come through. I think what we'll do now for everybody is Dr. Ahmed will speak to Yassine, who has done a remarkable MS story here. So Dr. Ahmed will speak to Yassine now. He'll tell the story, and then we'll open up at the end of this in 5 minutes time again for more questions. So please keep writing your questions down for Yassine, for Dr. Ahmed, and then we will finish up. But for now, Dr. Ahmed and Yassine, it's over to you.
Thank you, Gerard. Hello, Yassine. Kifak, how are you?
Hello, Doctor. I'm good. How about you, Doctor?
Alhamdulillah, excellent. I would like to first welcome Yassine. He is a patient of mine. He's a patient, but he's also very dear to me. He's been following with me for 4 years, and he has a remarkable story he'd like to share with people who have MS or who may be recently diagnosed with MS. So thank you, Yassine, for coming today, telling us
Welcome,
about
Doctor.
your story.
Welcome.
Thank you. So I want to start off by asking you, we know that what's your name? How old were you when you were diagnosed? And what were
Uh,
your first symptoms when you got diagnosed?
okay, my name is Yasin Abdul Rashid Al Belushi. It came to me in 2016 when I was having job in Sheikh Zayed Mosque. At that time, I could not walk properly. After 2 steps, I was falling down. And my father, he got scared of this and all things, and he took me in hospital, which is in Abu Dhabi, UAE, Abu Dhabi, in Baniyas, Al Mafraq, now which is closed. With the one who did my operation, it was Dr. Ahmed Shatila who helped me out.
What were your symptoms at the time like? I know or I can actually ask you, when you were first diagnosed or after your second attack, Yassine, I mean, you were 17 years old at the time, right?
16.
16. And after the attack, you were now in a wheelchair and in diapers. How did you
Yeah,
feel? Like, how did that make you feel as a 16-year-old how does that make you feel? How did that make you feel?
I said that I will not be able to walk and all. So
It's,
I think got scared a lot. My parents, they were scared because of me, and they was worrying about me, and they talked to you, and you said, I'm very small, and you will help me out. And you helped me. Alhamdulillah.
Alhamdulillah. Alhamdulillah. So now you've taken your medicine and we did give you some medicine. And the purpose of this lecture, again, as I said, is not to advertise medication, but it is to emphasize the importance of seeing a doctor, the importance of following up with a doctor. And no, so we started on medicine. Alhamdulillah, you responded. You did very well. Alhamdulillah
Very
أخذ
well.
دواء وتجاوب كثير منيح مع الدواء. وهدف
Alhamdulillah.
هالمحاضرة مش لنعمل دعاية للدواء بس نأكد للناس لازم تشوفوا الطبيب، لازم تتابعوا مع الطبيب توثقوا فيه لأن this can be a devastating disease. So Yassine, after medicine, and you did some physical therapy and وعملت exercise, كيفك هلا? How are you doing right now?
I'm really very good, Doctor. I'm very good. I'm enjoying my
Alhamdulillah.
life by exercises and all.
Alhamdulillah. So
Alhamdulillah.
just to give an idea, you're not in a wheelchair right now, Mehek,
Yeah, I'm not.
and you're not wearing diapers anymore, right?
No, Doctor. Before I was using
Alhamdulillah.
a stick, kind of a stick also. But right now
Alhamdulillah.
I'm alone. I'm walking
Alhamdulillah.
with my legs safely. Alhamdulillah.
Excellent. I'd like to share a little story about Yassine. One time his father called me on the phone and it's like, Yassine
Mm.
is really tired. He can't walk. He doesn't feel good. So I was like, come to clinic tomorrow. I'll see Yassine. So he comes to clinic and he's talking to me and he's not weak. He's strong. He's walking good. So I'm like, tell me more. What do you mean he's tired? He said yesterday he walked from his house to Wahda
Most.
Mall, which was
Oh, wait,
about maybe
no.
like 15 kilos. And I'm like, he's
15
like, yeah, he
kilos.
got tired. I'm like, yeah, حتتعب إذا مشيت 15 kilo in one day. You'll get tired if you walk 15 kilos in one day. So alhamdulillah, he's done remarkably well. But
Very
this is
well.
not, this is, everyone's different. كل واحد غير. بس إنه أهم شيء إنه you do follow up. إنه what would you tell a patient اللي عنده MS recently diagnosed, Yassine? How important is it to follow up and go see a doctor?
Yeah, for MS, those who have MS, they have to take care. They have to go to hospital to the doctors, and they have to do exercise, lot of exercise. Do that much that you can able to do. Don't do that much you cannot able to do. All right, doctor?
Alhamdulillah. And anything else you'd like to tell the audience or people? Anything else you'd
What?
like to send? This is it. Feel free.
Yeah, to be free. Right now there is Corona, stay home and be safe. But you're also having that MS, so you have to go to hospital to show the doctors and all. You have to be careful about you.
Alhamdulillah. So stay safe, eat healthy, exercise, and you have to follow up and do. Excellent. Thank you, Yassine, very much
Most welcome,
for coming today and sharing your story with people.
You're most welcome, Doctor. You're most welcome.
I'm sure it will give people that are recently diagnosed some motivation that it is not just a depressing illness with no cure or no treatment. And no fi amal, alhamdulillah. Thank you.
Alhamdulillah.
Thank you, Yassine.
Okay. Bye.
Bye-bye. Thank you.
Bye.
Say hi to your dad for me.
Okay. Thank you, Yassine. A remarkable story, considering that he was in hospital for a long time, you know, and he had many complications, and now he's a young, vibrant man, and you know, trying to fulfill his dreams. He's an inspiration.
Yes. Great kid, doing good, doing excellent, actually.
So I think we will finish now. There are some questions. If Yassine can join us, feel free if he wishes to join us. What we'll do is, Doctor, a question here from somebody in the GCC.
Okay.
They're asking is, if I go out in the sun too much, or in terms of, do I need to take more vitamin D, or being out in the sun, does it affect or aggravate my MS?
Good question. Thank you. السؤال هو انه بخص الفيتامين دي والحر الشمس. First of all, people with MS can be sensitive for heat. في بعض الناس اللي بيطلع لهم او عندهم MS بيتعبوا زياده مع الحراره العاليه. Hot summer days, hot showers, حمام مي سخن, or even just يوم حار مثلا بالامارات هلا الحراره 44. It's 44 in the UAE right now. So being out in the sun can make you more tired. بالمية على الأكيد. Vitamin D, we know that الناس اللي عندهم MS في عندهم نقص بالvitamin D. They have a low vitamin D. But if you live in the UAE or in the GCC, we all have low vitamin D because we don't go out in the sun because of the heat. So I would say if your vitamin D is low, لازم تعود, you have to replace it to get it normal. But if you're normal, you're good. But so no, most of us have low. I have low vitamin D. I'm sure Gerard has low vitamin D. It's living indoors. It's just the way we live. Alhamdulillah. Okay,
thank you. I've had a private question come in saying I've been recently diagnosed again. I used to be very laid back, but now I find myself very short-tempered, very agitated. I react to my family in ways that I shouldn't. Is this normal of me becoming MS, or is this a mental state of mind?
Thank you for the question. سؤال انه في حدا مشخص جديد مع MS وعم بيحس عنده أرق زيادة, عم بيعصب زيادة, حاسس حاله زعلان انه and the question حسب ما فهمت are these symptoms من MS or is it from something else? I mean, I guess the answer to your question are multiple things. Could it be depression? Maybe. Could it just be the shock of being recently diagnosed? And maybe you had your whole life planned for you, but now you're thinking, what am I going to do now with my life, or what are my plans? Maybe that's the reason why you're agitated or feeling angry. So there may be multiple reasons, but I think it is important to see somebody. You may want to see a psychiatrist or a psychologist to further elaborate and talk about your feelings.
Okay. Thank you. A common question, actually, I thought I'd leave it to the end. In terms of patient support groups here in the UAE, some people are asking about, are there somewhere patients to connect, support groups in the UAE that you're aware of?
There is the UAE MS Society. في الجمعية لتصلب اللوائح بالإمارات العربية المتحدة. That's where I would recommend starting off, is reaching out to them, seeing if they can help you. So أول شيء إنه بنصح or recommend إنه تحكي مع الجمعية لتصلب اللوائح بالإمارات. You can talk with them. Other way patients interact are these patient venues that we're doing right now. Now, before Corona, It used to be in real life, and people got to meet each other, and we used to have lunch, and people would share their experiences. Unfortunately, my Corona, it changed a little bit, but inshallah, we'll get back to that in the future. And then there's WhatsApp groups and small groups, but MS has become one of those diseases that almost everybody knows somebody with the illness. So if you really ask around, you may find more people than you know who suffer from MS, and that is in a way your own little group. Thank you.
Thank you, Doctor. A very nice presentation and a good case study with Yassine to show the success, and a very vibrant discussion forum as well. I believe we can draw an end to the webinar. In case there are any final questions, you can type them quickly in the next few minutes. In the meantime, I would just like to say that this is the start of a summer schedule of MS patient-focused webinars. Tonight, Wednesday, is the first, but from every Saturday onwards, at 3 p.m. UAE time, we will be hosting a webinar for roughly 1 hour. And each webinar will be on a specific topic. So as you've discussed, mental health, exercise, nutrition, many different interesting things as well. So we'll be looking at the alternatives and also the critical elements, so to help you give a full rounded perspective on MS. And we will be asking you to complete some surveys throughout the summertime, so we can see how you're feeling about these webinars. But please feel free to join us this Saturday at 3 p.m. UAE time, when the topic will be, how do I know I'm getting better? Which of course is a question you all want to be asking, and I'm sure the speaker will be Dr. Moustafa Shara from Sheikh Khalifa Medical City in Abu Dhabi. Dr. Ahmed will of course be joining us again to moderate it, and I think this will be a very, very interesting topic. So please put that in your diary. You have registered for this one, so you are automatically registered for every webinar now. So every Saturday you will receive a link that you can then log into and read and watch this. So unless there are any final from you, Dr. Ahmed, that you would like to leave us with?
Yes, one final thing. كل المحاضرات مسجلين. So إذا بدكم السلايد كله مسجل. We will give you a link. حنعطيكم link you can go to see the lectures, to hear the video all over again. And I would like to say thank you everyone for attending. Hopefully for the people who have MS and have heard this information, hopefully you've built your knowledge. And for people who just got diagnosed or know someone who was recently diagnosed, hopefully this gives you better knowledge so that you can talk to them. Thank you very much.
Thank you, Dr. Ahmed. Thank you all for joining us wherever you are in the world. I'm wishing you a good night, and I will now be ending this webinar. Thank you all. Take care.
Bye-bye.